Hi, my name is Dr. Bob Applegate. I'm a professor of cardiology at Wake Forest University School of Medicine in Winston-Salem. I've been there since 1987. I was the program director at Wake Forest for over 20 years and had, during that time, over 100 fellows rotate through our program. One of the things that I would say is probably the most important piece of advice that I could give to the fellows is follow your passion. Don't do this for any other reason. Do it because you love to do it. And I think in the end you'll find out that that is going to guide your career choices better than anything else.
My advice to fellows as they're preparing for their career would be twofold. One, identify a mentor. Your mentor can be at your own institution or somebody at the national level who can guide you through your career. And secondly, pick an area of expertise. You can't be an expert in everything, so pick one or two areas that you want to be known in your region and around the country. That's your area of expertise, and get all the training as well as your focused area of research and publication within that one focused area.
So I'm Zoltan Turi. I work at Hackensack University Medical Center. I've been a member of SCAI since very early in my career, when it was a very small society. I've been at the SCAI Interventional Fellows course for many, many years and have run it in the past. It is the most fun of any teaching that we do during the year, because some of the things that we can teach may be helpful for a lifetime or perhaps for the next week. I guess one thought I have in terms of advice is that I have legions of fellows that I've trained out there. Occasionally one of them will very proudly tell me that he does things exactly the way that I taught him 25 years ago. That always makes me very proud, but also horrified, because things change and I don't do anything the way I did 25 years ago. It's very important as you go through your career to take the things that you've learned, but to adapt. Technology changes, our understanding of patients and patient care and proper procedures changes. And so it's very important not to get stuck in just the things that we teach you, but to keep an open mind about adapting. One other thing I would mention is that it's really important as you go forward with your career to do something that you really love. And if you find yourself doing one thing but would really like to do another, keep an open mind about taking time to train properly. In my case, I wanted to do peripherals and carotids. I took a year off, moved my family to eastern France, and although it was a difficult experience, it was a wonderful one, and I think it was incredibly helpful to me to let me evolve as an interventional cardiologist.
People often ask me about innovation and entrepreneurship. It's not just one creative act. I think the way it can best be described is you are what you do repeatedly, and it becomes a habit. And I think so often people, when they're starting their careers, think, oh, if I just had that one break. I do think luck is important, but I think you make your own luck. And the harder you work, the luckier you get. So you're going to work hard if you find things that you find that you love to do. And you should find something that makes you feel as though you're not even working, that you can't even believe they're paying you to do this, or that, boy, the days are too short and the nights are too long. I think one of the other problems was when you're young, you think, I did something good today, and therefore something good should happen to me today. That's not the way it works. You do something good for those 10,000 hours that it takes for you to become whatever you're going to become, and then something good happens. So be patient. Be patient with yourself. Never, ever, ever give up. And I think some of the most important things are courage to follow your dreams, but also then the persistence to carry them out. Thanks.